Hello, my name is Henry Torresona. I'm going to talk about the coronavirus, how to prevent it, and we're going to talk about the treatment. Okay, so I hope you enjoy the video, and I hope it can inform you and give you different ways to treat the virus. Okay, so today I'm going to start talking about the coronavirus, how to treat it, and what tips for prevention we have for it. Okay, so today we're going to talk about the treatment of the coronavirus and its prevention. Okay, so it's really important, and we're going to talk about the treatment that was released today by the Chinese government. Okay, so I will introduce you to this treatment, and then we're going to see how to treat the coronavirus. Okay, so first of all, I want to introduce you to Dr. Zhang Bo Li, that he is in charge of the research of how to treat the virus in China. He's one of the doctors in charge. He's director of the Tianjin Medical University of Chinese Medicine, and he also is the director of the first teaching hospital of the same university. And he and his team, he was in charge of going, I'm going to put here the introduction. He was in charge of going to Hubei, to the province where the virus, to the epicenter of the virus. And then he was treating there a lot of patients with the coronavirus, and then they create this treatment plan that I'm going to introduce you today. Okay, so it's important to know that you know about Zhang Bo Li, that he was the person credited for this treatment plan. Okay, so the first thing to know is like this virus started on China in December of 2019, and until today we still have like epidemic problem here in China especially. Okay, and then I'm going to introduce you to the virus. So the first thing with the coronavirus, we have to know about the symptoms. Okay, so it's really important to know. Okay, so there are two types of people with coronavirus, and that's the way how the patients show the symptoms. Okay, so we're going to have two types of patients. The first one is going to show kind of like milder symptoms, and the other one is going to show more they're kind of like more related symptoms to the pneumonia. Okay, so the first patient is going to have fever, chest pain, chills, rapid heartbeat, breathing difficulties, pneumonia, and kidney failures. Okay, so the most important here is like usually these patients have like all the symptoms of a cold, a common cold. Okay, and the other one, instead of having all these symptoms, the most important thing is like they are going to have shortness of breath. Okay, and then they're going to have some digestive problems. Okay, with all these two patients, with these two types of patients, they are all going to experience fatigue. Okay, so all the patients are feeling kind of like lack of energy, and that's actually what the virus most important symptoms are. Okay, right now I'm going to introduce you to the treatment. As I told you, like this treatment, it's approved by the National Health Commission in China, and Dr. Zhang Bo Li was one of the doctors in charge of this treatment plan, and he is treating a lot of patients there in Wuhan right now in this moment, and treating a lot of patients successfully with Chinese medicine. So for the treatment, as I just explained you, we are going to have two cases, okay, for this. So as I just explained you, the first one, fatigue with gastrointestinal discomfort, and the second case is going to have fatigue and fever, okay, and with all the symptoms I just give you there, okay. And we're going to see there that we have two special formulas to treat the virus, okay. So we have to have in mind there is only two cases. And then these cases are going to have different stages, okay? So, but out of these two cases, there are not more cases anymore, okay? So this is the most important thing to know. So the first formula for the first case, we have it there, is going to be 藿香正气汤, okay? 藿香正气丸. So if you want to, you can check it online. It's really easy formula, but we are going to actually study it just in a few minutes, okay? We're going to study it in a few minutes. And the second formula, we have different formulas. One of them is 银翘消毒饮, okay, 消毒片, 疏风消毒, and the last one is 凉化清益胶囊, okay. So we have there 清丸 胶囊. So we have there three formulas, and then we are going to talk about them, okay. So as I told you, this virus, it has different stages, okay. So it's important to know we have the two cases, and then we are going to develop 4 different stages. So the first stage is going to be a mild stage. Then we're going to have a more serious stage, dangerous stage, and the rehabilitation stage. Okay, that's how I translated everything today, so maybe the translation is not the best. Okay, so the first thing, in the mild stage, we're going to have two differentiations, okay, of symptoms and syndromes. Okay, so the first thing is because we're going to have dampness invading the exterior. And then the second one is going to be dampness invading the lungs and the spleen. So it means that actually the virus in this case, or the pathogen in this case, is in the it's kind of like superficial. Okay, it's not an internal pathogen; it's in the exterior. Okay. The second stage that is a little bit more serious, the serious stage, we are going to have hot plague invading the lungs. Okay, and then we are going to have a dangerous state. When most of the patients at this stage they lose conscious, and then it's kind of like really bad. Like we call it dangerous state, or I call it dangerous state because on this stage the patient can die. So the probability for a patient to get recovered from this stage is lower than the other two stages. Okay. And then we're going to have a last stage that is a rehabilitation stage. So after a lot of patients, after having the virus itself and after getting kind of like okay with the treatment, they notice that these patients actually have two patterns. Okay, one is deficiency of qi and yin, and the other one is deficiency of spleen and kidneys, and it will help to improve the other symptoms the patients might have. Okay. Right now I'm going to talk about the mild stage. That is really important. So the first thing about the mild stage, we're going to talk about the first syndrome differentiation. Okay, so it's going to be dampness invading the exterior. Okay, so we are going to see that this stage it's actually an exterior pathogen. Okay, invading the body. So in this case we are talking about dampness. Okay, so this virus is especially dampness more than other thing, okay? And then dampness and heat and other things, but in this case it's dampness in the exterior, okay? So we are going to see all the basic symptoms of dampness and kind of like the cold, the common cold, okay? So we are going to have fever, cough, we are going to have dry cough as we have it here, as we have it there, chills, okay? Congestion, runny nose, dry throat, okay, sore throat, poor appetite. So in this case also will affect the digestive system, okay. We have to have in mind that this virus, it affects directly the spleen and the lung meridian, okay. So especially affects these two meridians, okay. Later we're going to talk about why, and then as we see, we have some symptoms that are related with these two stages, okay. Then we're going to have a red tongue with thin and yellow greasy fur. So actually, this greasy yellow fur, it's really common for this virus. And then the thing is, like, of course, it's greasy and it's thick because of the, sometimes it's thin, but sometimes it's thick. And that means that there is dampness inside, okay? And the pulse is going to be slippery, really easy pulse for dampness pathogens invading the body, okay? So there is nothing really to say there. And then what we're going to try to do is to clear dampness and expel the pathogen. Even if you want to treat the patient with acupuncture, it doesn't matter, okay? So the main, how to say, like if you understand how to treat it, like what is the main symptoms, what is the treatment principle and everything, then you can use acupuncture as well. I'm just introducing the Chinese medicine and the formulas that you can use. And then yeah, you can actually, in the practice, or I mean, if you use acupuncture, if you use Chinese medicine, you can use either like any of them, okay? So the thing here is like, we go to the formula, just talk about, okay, this formula that calls 藿香正气, okay? 藿香正气汤. So we're going to use that formula to treat, especially like a lot of cases of this virus, okay? So in this case, look, we have the formula there and we add some herbs. So here down I wrote all the herbs, okay? I'm not going to read them all because if not the video is going to be too long, okay? So you can check there. I wrote the name of the herbs in Chinese and also in Pinyin, okay? So you can check if you have any questions, okay? For some additional herbs, so we can see here, if the patient has sputum, okay, and yellow and sticky, and also with a sore throat or dryness, we are going to add this herb, okay, 蛇干. Then if the patient has a dry mouth, that means that there is yin deficiency, we are going to add maidong, okay. Dry stools, we are going to add baichu, okay. Then if there is cough and then the cough is still there and it didn't reduce with the main formula, so we are going to add more of Tianhu and Siyuan. In this case, Tianhu is 10 grams and Siyuan is 10 grams, so we can add up to 15 grams, okay? Right now, in the mild stage, we're going to see the second one. That this one is between the mild stage. This one is more heavy than the other one. Okay, the other one is more in the exterior. This one, the pathogen is coming from the exterior and is invading the interior. Okay, so as I told you before, it's invading the lungs and the spleen, and this is the most important thing. Okay, so in this case, it's the same. We're going to have symptoms of lungs and also symptoms related with the spleen. Okay, so in this case, we have low fever, sometimes no fever. Okay, in the mild stage, cough, little spume. Okay, dry cough. Okay, nagging. I don't know why I wrote nagging there. I mean, it's just a translation. Sorry. So we are going to feel some oppression in the chest. Okay, diarrhea. This is like really common symptom, the diarrhea. What else? Low of energy or chi deficiency, okay? And then these people usually they don't want to talk, okay? Due to the deficiency of the spleen, okay? Because the dampness is attacking the spleen, so all the spleen function is going to affect the spleen function, okay? Of creating chi, and then the patient is going to have deficiency of chi, and also is affecting the lungs. So actually, that's why, okay? Then we are going to have a dark red, white or yellow greasy fur, but usually it's yellow, okay? And then in this case we're going to have a roux pulse. Roux pulse also is for dampness, okay? So it's really easy, okay? The treatment principle is to clear the dampness and regulate the triple burner. Then we have there the formula. So this formula is going to base more on expelling or clearing the dampness than take out the pathogen to the exterior. Okay, so we can see that the first herbs we have here, for example, Yiren, Baicoren, Baichu, they're Hopo, Champi, Fuling, they're all herbs that will clear dampness. Okay, and in this case also will regulate the triple burner. We are using, for example, Banxia to expel the pathogen, okay, and Hopo, okay. Sorry, there is something there. And for the additional herbs, you can read there. For example, I mean, in this case, maybe if there is more heavy dampness symptoms, we can use Cao Guo, Changzhu, and Qinggao, okay? If the patient is showing more serious fever, we can use Shigao, okay? So remember, Shigao is one of the best herbs to actually take down the fever, okay? So we have Baihutang, okay, Baihutang, we have Shigao, Zhimu, so we can use Baihutang in this case, okay? So look, low energy, okay, so Qi deficiency and no desire to tang, we can use Tangshen, because Tangshen is entering in the spleen meridian with Jinshen, okay? So we can actually use or Tangshen or Jinshen, okay? What else we have here? Like, it's kind of like important. I mean, you can read it there. I will leave it there. You can actually see the other things. I'm just actually pointing what is more important, okay? Right now, we're going to go to a more serious stage. In this case, there is only one type of serious stage, and is when the hot phlegm it's invading the lungs. So in this case, what happened? The phlegm, the dampness, transformed into hot, okay? So in this case, there is hot phlegm and it's invading the lungs. This phlegm is created because of the dampness that there was before in the previous stage, and then in this case we are going to have fever. Okay, in this stage there is going to be fever. Okay, usually the patient is showing symptoms of fever, coughing for sure. Okay, the patient is going to cough a lot. Okay, shortness of breath. Okay, that's also for sure. Some patients will feel palpitations, or they're going to feel oppression in the chest, dry mouth, thirst, okay, dizziness, okay, dry stools, red tongue, okay, the same, yellow greasy or yellow dry okay, it's really important. The pulse is slippery, remember there is dampness, and fast, okay, because there is hot also at the same time. 热, there is hot. So the treatment principle to clear the heat and the phlegm and purify the lungs and treat the cough, okay? So we're going to see here the formula. In this formula, we are going to treat the hot symptoms, okay? The hot, for example, we have, in this case, we have 舌干, we have 还清, okay? We have 丹参. And then we're also going to treat at the same time the dampness, okay? So we have, and the coughing, because in this case, the patient is coughing more. And then it's important, for example, to use herbs as 杏仁, 半夏, gualo, okay, 桔梗, 厚朴, okay, so this is going to help us to calm down the coughing, okay, so in this stage is really important because the patient for sure is going to cough, okay. For some additional herbs, so for example, if the patient has a lot of phlegm and a lot of dampness, we can add 苏丝, we can add 赖丝丝, okay. And for example, for the fever, I just told you we can use 白虎汤, we can use 石膏, we can use 栀子, we can use 鱼腥草, okay, really important herbs, these three. For dry stools, like indeficiency, we can also use 生地黄, okay, and for constipation, we can use 大黄, okay. If we're going to use 大黄for constipation, don't use a lot, okay, we're going to use only a little bit, maybe we start from 5 grams, and then we can increase the amount till 12 or 15, depending on the case of the patient, but we advise to start to use a little amount, okay, don't use a lot, okay, and we can add also Midone. Right now, for the dangerous state, I just introduced that in this dangerous state, usually the patients are, it's like really serious, so a lot of patients are going to have dyspnea, okay, so it's difficulty, they're not going to be able to breathe good, okay, they're going to have some kind of asthmatic ventilation, okay. Some of the patients will faint. They are going to have all the symptoms of losing the yang. Okay, when you actually lose the yang, there is actually a stage of the yang where you lose all your yang. So you're going to have that kind of stage. Okay, you faint, you feel cold on your forelimbs. Okay, so the same look, thick and yellow or dry fur, okay, that's really important. The pulse is going to be floating, okay, why is floating and with no roots? It's floating and with no roots because there is a yang deficiency and it's too extreme, okay, we're losing all our yang, so we have to recover that yang, so we're going to tonify the qi and warm the yang. In this case, we are going to focus on bring again the yang qi to this person, okay, so in this case we can use really good formula, 四逆汤, okay, 四逆汤. We have here we use 人参, we use 附子, we use 山茱萸, but in this case we can use also 四逆汤, really good, okay, but it's the same principle in some way, okay. And in this case they say that also with this formula we have to use or this formula that calls 复苏荷香丸, okay, or the other formula that is really famous that calls 安宫牛黄丸, okay, that formula it's really good for this kind of symptoms, okay, when the patient faints and there is no conscience and this kind of thing, okay. Finally, I'm going to talk you about the rehabilitation stage that is important, okay, when the patients get recover, or at least they get good prognosis, okay, we're going to actually see that we have two types of stages in this case. In the first one, we are going to have a deficiency of qi and yin that is produced because of the patient was coughing a lot, okay, so actually that produce a deficiency of yin and qi, okay. And the other one is we are going to have a deficiency of spleen and kidneys, okay, so in this case it's all the typical syndromes of deficiency of qi, okay, so you feel weak, you don't want to eat, you feel discomfort, you sweat at night, okay, hot hands, okay, so it's like really common symptoms of deficiency of qi and yin, and then the pulse is going to be raw or thin pulse, okay. So the principle the same again, we're going to tonify the qi, nourish the yin, regulate digestion. Remember that this pathogen, he goes with the spleen, okay, he's together with the spleen, so we want to also regulate the digestion, okay. And we are going to spell phlegm because even that the patient still has some dampness inside, even with the deficiency of Qi and Yi, the patient still has some dampness, So in these kind of cases, we are going to use herbs first to tonify the spleen. That is really important. We can use Taisishen. We have it there, Taisishen. We are going to use some herbs to tonify the yin, for example, Maidong, Wuweizi, okay? And then we are going to use our herbs to expel the dampness. So for example, Banxia, Champi, Fuding, okay? And for example, we have Shen Qu to regulate the digestive system and everything, okay? So in this case, it's important to know if the patient has a really bad deficiency of, if has a mild deficiency of Qi, we can use Huangjing, okay? So Huangjing is the sorry, I don't have the term, but it's the yellow part of the egg. You have the egg, you just take the yellow part and then you can put it inside the formula and boil it with that, okay? But if it's a strong deficiency of Qi and also the patient is sweating a lot, we can use Huang Qi. That is a really good formula, okay? And for Yin deficiency, we can use Jinshen. We can use the Wisconsin Jinshen that is really famous in America. Right now, the second one is the deficiency of spleen and kidneys, okay? So in this case, it's the same. Where there is dampness still, if there is deficiency of spleen, there is deficiency of Qi, and if there is deficiency of kidneys, there is a lot of symptoms related with the kidneys, okay? So for example, in this case, we have a pale complexion, really easy, okay? Dizziness, tinnitus, okay? Pain in the lumbar area or the knees, okay? Abdominal distension, loose stools, okay? And also like the tongue is white, sometimes yellow, okay, for thin and a weak pulse, okay? This patient is weak, it's a little bit weak, so we are going to have a weak pulse. And principle here, we are going to tonify the Qi and the spleen, warm the yang, and fortify the kidney. So in this case, we are going to focus on tonify the kidneys, tonify the spleen, take out the dampness. That's the most important thing, okay? So for tonify the spleen, we have Tangshen, okay, so it's a type of ginseng. We have Baizhu, we have Fuling, we have Shangyao, okay? And for example, for kidney, we have Shangwu Zhuyu, okay? We have Shudi Huang, Rogui, and also Shangyao, it's also good for that. We have the Liu Wei Di Huan, okay? Here we have the formula Liu Wei Di Huan, okay? Partially, but we have it there. And then also for taking out some dampness, we can use Chenpi, that is the skin of the tangerine. We have Huchuang, okay? And Shenqu to regulate the digestive system, okay? In this case, something to add, like I think here the most important thing, so here I have a note. So it says if the virus is still there, use Yu Xingzao and Ma Bianzao, okay? So these two herbs with Shigao, so it means if the patient is still presenting some symptoms like fever, we can use these two herbs, okay? Yu Xingzao, Ma Bianzao, and Shigao. I told you before, okay? Okay, right now we're going to talk about the coronavirus prevention. That is really important. Right now, there is a lot of misconception about the coronavirus. A lot of people think it's just like cold, a common cold. Actually, coronavirus produce pneumonia, so we have to be careful. It's not a really lethal virus, there is a lot of statistics already, there is a lot of studies, but still, it can kill people. We have to prevent it, and it's really important, the prevention, okay? So the first thing is like we have to use masks, like the mask to cover yourself, because, I read a lot that there's a lot of people that they're not using the mask. So the point with this virus is like this virus has 14 to 28 days incubation time, so it means that sometimes you can have the virus without presenting any symptoms, okay? So if I have the virus but I'm not presenting any symptoms, I will think that I'm okay, If I'm walking in the street, touching everyone, kissing everyone, talking, even when you talk, the saliva will go from your mouth, you will infect other people. So that's why we have to use the mask, and also to avoid that other people spread like saliva or something on us. Okay, so it's really important. It's a must. We have to cover ourselves with mask if you are going to go outside. Okay. Second thing, hand washing. Okay, you have to wash your hands every time you go out from your house, every time you go to work, every time you arrive to a new place. Okay, if you were outside and then you came back to a place, wash your hands. It just takes like 10 seconds. There's a lot of videos online that teach you how to wash your hands, so it's really important. Third thing, do not touch your nose, mouth, eyes, okay, without first washing your hands. Okay, it's really important. Why? Because the virus, it can be transmitted through the air. Okay, it's an airborne virus. But the things like also like if you have the virus in your hands and then you scratch your mouth, your nose, your eyes, then you are going to probably you are going to have the virus. So it's important to wash your hands first and then try to be careful. Second thing, keep everything ventilated, okay? Open the windows if you're in the office. Open the windows if you're in the house. Try to open the windows at least 1 hour a day so you can you can let the air come through, and kind of like move to a new environment, a newer thing, okay? 5, avoid places where there are too many people. That's for sure. If there is concerts or things where you think there are going to be a lot of people, try to don't go, okay? Because the risk of infection is more, and then it's dangerous. Okay. Then it says don't share cutlery. Sorry, I cannot pronounce the word. So yeah, if you are eating with someone, don't. Even with your girlfriend. I think it's unavailable. But if you are going to eat with someone, don't share. Okay, don't share the things, or don't give. For example, if you are eating a hot dog, don't give your own hot dog to other people. Try to do these things, at least for this time, okay? And the last thing is to avoid greeting with kisses or shake hands, okay? Try to have the less possible contact as you can with people, okay? You can just say hi, but you don't have to kiss them and hug them and kiss them and shake their hands. It's fine. The last thing I want is to thank you. I hope you liked the video. I hope it was informative enough. I will try to post more videos about this if you want it, if you like it. My name is Henry Tarazona. I'm a Chinese doctor. And yeah, if you need more information, just let me know. I hope you like the video. Thank you very much.